Hello and a very good afternoon to all our viewers who are joining me in this live interaction of News9's Facebook and also the YouTube page. And even as we, continue to study more about COVID-19, doctors and medical researchers have hinted that COVID-19 has become a chronic condition for thousands of people across the world. Every single day, new studies surrounding COVID-19 continues to emerge. And in the latest, some people, which the doctors say are even continuing to deal with the lingering COVID-19 symptoms even weeks and months after first contracting the virus and recovering as well. So they are calling this particular syndrome as post-COVID syndrome. And in fact, there's a new name that has also been coined for people who have developed, long-lasting symptoms even after recovering from COVID-19. And these are called COVID-19 long haulers. So according to the CDC, which is the Center for Disease Control, study, one of the studies said that nearly 1 in 5 18 to 34-year-old adults with no chronic medical conditions reported that they had not returned to their usual state of health even 14 to 21 days after testing positive for COVID-19. So the long-lasting symptoms which the study reported also included troubled breathing, headaches, memory difficulty, overwhelming fatigue, and even persistent loss of taste and smell, apart from experiencing the worsening of pre-COVID ailments such as diabetes, hypertension, and even anxiety and panic attack problems as well. So in order to answer a few questions that surround this particular study, we have with us Dr. Sitesh Roy joining us live from Mumbai. Many thanks for joining me, Doctor. And my first question to you today is, what does COVID-19 long haulers actually mean?
So Deepak, it has been found that this is not the first published data. There has been data coming out for the past at least 2.5 months now that show that even after a person has recovered from what seems like the acute phase of COVID-19, where their fever has gone away, maybe their breathlessness or their low oxygen levels, or if they were hospitalized, they've been discharged from the hospital. But even beyond that, the symptoms tend to persist, and the symptoms can range anywhere from simple body ache or what is called muscle ache, myalgia, to fatigue, and all the way to actually continuing to have breathlessness, continuing to have cardiac issues, and the list is very, very long at this point of time. In fact, one study that included people of all ages, so it also included elderly individuals, found that 87% people, mark my words, 87% people, even after being declared as being non-COVID positive, their tests were negative on the RT-PCR, was still having at least one symptom related to COVID-19, even up to 2 months or 3 months after the infection. So this is a very high number. The current study primarily looked at people between the ages of 18 and 35. So they were looking at young people. And amongst young people, they found that 1 out of 5 young people, that would be 20% young people also, tend to have ongoing symptoms. And some of these symptoms are problems that they did not experience before they had COVID-19. Like you mentioned, the anxiety or panic. These are people who were perfectly healthy and well before they got COVID-19. But after the COVID-19, they continue to have anxiety, panic, what is called brain fog, not being able to remember things as they normally do, getting tired very easily. Like they may do a couple of 2 or 3 phone calls that they have to do, and then they feel fatigued and have to go and lay down. We are seeing this in our practices a lot. And this is something that people have to be aware about and be careful about.
Also, doctor, one of the COVID-19 recovered patients who happened to be very close to me, his father tested positive recently, and while shifting his father in an ambulance to a COVID hospital, this particular person, experienced a panic attack and also seizures. So when everything, came back to normal and he visited a doctor, the doctor told him that these are post-COVID symptoms. So this person had a history of, panic attacks and also anxiety, but the attack that he experienced wasn't as worse as he would experience one before he was, diagnosed of COVID-19. So could pre-COVID condition worsen after recovering from COVID-19?
They absolutely are. In fact, we have seen several patients who have had no history of seizures before they had COVID-19 infection, and during the COVID-19 infection, they may have had very just bad headaches or a little altered sensorium when they were in the hospital or in the ICU, but later on, they have developed seizures and the seizures have persisted even beyond the COVID recovery phase. Same with anxiety, same with panic attacks, sometimes even hypertensive episodes, which a person did not have before and had just regular normal hypertension. Those have become hypertensive emergencies later on. So clearly this virus, we now know, binds to a protein called neuropilin-1 in the brain and nervous system, and it has mechanisms by which it alters the pain and sensory mechanism in the nervous system. And we certainly know that the virus has been detected in cerebrospinal fluid, which is the fluid that surrounds our brain and circulates through our brain and our spinal cord. Okay. So we know that this virus is very much having access to our nervous system, and the more we study it and follow it, we are realizing that it's actually causing post-COVID consequences and sequelae, which are really relevant and are affecting people in their day-to-day life and functioning.
Also, doctor, now how dangerous could these symptoms be, especially in the elderly ones?
Certainly, we are seeing cases where people are, after having COVID-19, come.
Well, there seems to be a technical problem that we are currently encountering. Well, like the doctor clearly mentioned, that COVID-19 virus, which has access to not just our normal cells by latching on to the ACE2 receptors, but they also have access to our nervous system, where they could latch on to something called as the neuropilin-1, which is the main reason why we experience the sensation of pain. This is directly connected to the nervous system, and when COVID-19 latches onto it, it nullifies the pain that a person experiences through different conditions, and this could probably alter the way we feel or sense things. So the doctor is back online. So yeah, doctor.
So Deepak, an important and interesting feature to look at with regards to viruses. So when we take the common chickenpox virus, okay, this virus has been known to stay in our nerves for years together. So someone may have had chickenpox when they were a child, but they can get something called shingles or varicella zoster even when they are 50, 60, 70 years old. Okay. Which is a reactivation of the chickenpox virus that was sitting dormant in their nerves. We don't know if COVID-19 is capable of doing that. We don't know whether the COVID-19 virus just leaves the nervous system in a hyperactive state even after it has left the body and the immune system has cleared it out. And certainly elderly individuals are at highest risk for this because they already may have pre-existing diabetes, hypertension, heart disease, which could get worse, or kidney disease for that matter, or a neurological condition like seizures and anxiety or depression, all of which could get worse due to this virus. So clearly people of all ages and especially elderly individuals are at risk post-COVID, and it is the reason why all of us have to take every possible precaution and keep our guards up so that we don't get the infection in the first place and we don't transmit it to our loved ones and our senior citizens who are in our contact, and keep everyone safe. It is still so important for all of us to do that till we have a valid and worthwhile vaccine.
Now, doctor, speaking about precautions, how can one person, who is currently experiencing the post-COVID-19 syndrome overcome, or rather, get rid of this particular syndrome? Is there any treatment, or what can he do?
Sure. So the first thing I think is to seek medical care. If someone has a problem related to the nervous system and they feel it can be best handled by their family physician or their MD physician or a neurologist, they should accordingly seek medical care starting with their family physician. And I think all family physicians and general practitioners around the country should educate and update themselves about these post-COVID sequelae so that they can do timely referral if needed to super specialists. It is also very important for a person to maintain a healthy diet, do exercise, do yoga, pranayama, whatever else is required, get fresh air, so that they can bring their health and their immune system back to normal as soon as possible. Adequate sleep is also just as important. But the most important thing is if you are experiencing any post-COVID sequelae or symptoms, do talk to your healthcare professional. And if you feel you're not getting the right care, then seek specialist consultation also if need be, so that you can be appropriately treated. And we do have certain medications that may work for certain symptoms, but that's on a very individualized and case-by-case basis. Maintaining a good level of vitamin D that is healthy, not overdoing it, because hypervitaminosis of vitamin D is also risky. Maintaining a decent level of vitamin B12, which is important for the nervous system, also should not overdo it, because it can reach very high levels if it is supplemented without follow-up. All of these things can go a long way in keeping a person healthy after COVID-19 recovery. But I would still say the key is do your best not to catch it. Wear your mask, maintain physical distancing, hand wash, hand sanitize. Don't touch your face, eyes, nose, even if you have gloves on. By the way, gloves don't always protect you and they give you a false sense of security. And you need to keep sanitizing your gloves just as often as you need to keep sanitizing your hands. So with all those precautions, I hope that our viewers stay safe and keep their family members safe.
Right, Dr. Sitesh, many thanks for joining me in this live interaction. Well, that was Dr. Sitesh clearly telling us how one can overcome or rather get himself treated for a post-COVID-19 syndrome, because the only way that you can identify this particular syndrome is by consulting the doctors or your family doctors or even specialists. But like the doctor mentioned, why even reach such a point when you can safeguard yourself by following all the safety and precautionary measures right now in order to not catch COVID-19 infection? So the most important thing that you guys have to do is follow all the safety precautionary measures, maintain a good hand hygiene, and also wear your mask in the right place and in the right way. So if you guys have liked this piece of information that we've shared with you all today, please also like, share and subscribe to News9 on various social media platforms. Thank you for watching.